According to the World Health Organization diagnostic classification, osteoporosis is defined by a bone mineral density at the hip or lumbar spine that is less than or equal to 2.5 standard deviations below the mean bone mineral density of a young adult reference population. Who should be screened? Women 65 years or older and men age 70 years or older, and postmenopausal women above age 50, based on risk factor profile. Lifestyle measures for fracture prevention include, 1. Maintaining a healthy body weight, body mass index greater than 20. 2. Adequate dietary protein intake. 3. Avoiding cigarette smoking and excessive alcohol intake. 4. Lifelong physical activity, both weight-bearing exercise and muscle-strengthening exercise. 5. Vitamin D supplementation, 800 international units a day. What is the recommended intake of calcium? For women, the recommended dietary allowance for calcium is 1,000 mg a day for ages 19 to 50 years and 1,200 mg a day above age 50 years. For men, the recommended dietary allowance is 1,000 mg a day for ages 19 to 70 years and 1,200 mg a day above age 70 years. What is the recommended intake of vitamin D? The recommended dietary allowance for vitamin D is 800 to 1,000 international units a day for individuals 50 years and older. How should osteoporosis be diagnosed? Adults greater than 50 years with a history of hip or clinical vertebral fracture not due to excessive trauma. Those with existing vertebral fractures identified on the basis of a spinal imaging study alone. Those with a bone mineral density at or below the cutoff value of -2.5 standard deviations below that of a young white woman. Some medications reported to be associated with osteoporosis and higher fracture risk include long-term heparin use, certain seizure drugs, cyclosporine, tacrolimus, chemotherapeutic agents as aromatase inhibitors, glucocorticoids, thiazolidinediones, excessive doses of L-thyroxine, proton pump inhibitors, and SSRIs. How was a specific pharmacologic agent chosen for patients who are candidates for drug treatment? Bisphosphonates are generally the first-line agents for treatment of osteoporosis unless contraindicated. Candidates for denosumab include patients with contraindications or intolerance to oral or 4-bisphosphonates or those with severe renal impairment. Teriparatide reduces risk for vertebral and non-vertebral fractures among women with postmenopausal osteoporosis but has not been found to reduce the risk for hip fracture. Candidates for teriparatide treatment include patients with contraindications to oral or 4-bisphosphonates, those who have had a major osteoporotic fracture while receiving oral bisphosphonates, and treatment-naive persons with very low bone mineral density T-score. Contraindication to the use of teriparatide include patients whose risk of osteosarcoma is higher than baseline, patients with Paget disease, and history of skeletal radiation. Abaloparatide is a human parathyroid hormone peptide analog administered by daily subcutaneous injection. It is approved for treatment of postmenopausal women with osteoporosis who are at high risk for fracture. The efficacy and safety profiles and treatment period of abaloparatide are similar to those of teriparatide. Risk factors for osteonecrosis of the jaw in patients treated with potent anti-resorptive agents include poor oral hygiene, concomitant use of systemic glucocorticoids or chemotherapy, smoking, diabetes, and a recent history of invasive dental procedures. The majority of osteoporosis-related fractures result from falls. Risk factors for falling include personal history of falling, muscle weakness and gait, selected medications, balance, visual deficits, and dehydration. What is a Z-score? The bone mineral density compared to the bone mineral density of an age, sex, and ethnicity-matched reference population. What is a T-score? The bone mineral density compared to a young adult reference population of the same sex. The bone mineral density measured by DEXA scan at the 1/3 radius site can be used for diagnosing osteoporosis when the hip and lumbar spine cannot be measured, are unusable or uninterpretable. FRAX score is intended for postmenopausal women and men.